Recent data have suggested that CLL patients, in particular those with mutated immunoglobulin heavy chain genes, can have very prolonged responses to FCR chemoimmunotherapy with a 12-year PFS over 50%. We sought to investigate whether adding Ibrutinib to FCR would significantly improve on the complete remission and MRD negativity rate, with the goal of potentially curing more patients with CLL using FCR. We did enroll all patients on this study, both mutated and unmutated, and observed very high response rates. The MRD negativity rate in bone marrow, in fact, was over 80%, which was quite marked. The regimen was quite well tolerated, in fact, as well. We did not see any additional toxicity with the addition of Ibrutinib, other than one case of atrial fibrillation, which, as we know, is expected with Ibrutinib. However, infections were actually less than typically reported with FCR, as were cytopenias, likely due to the fact that we use mandatory prophylaxis and growth factor. The follow-up is still too short to comment on progression-free survival, but we're optimistic that given the very high bone marrow MRD negativity rate, we will observe a very extended PFS in these patients. And based on these data, we have expanded the study to enroll an additional 50 patients who will complete Ibrutinib with FCR with 2 years of Ibrutinib maintenance. And if they're MRD negative at that point, they'll discontinue Ibrutinib.